Hi, I'm Dr. Shruti Tannan. I'm a board-certified plastic surgeon, and this is my daughter, Lakshmi. Today, we're going to talk about skincare for middle schoolers. It's a question she gets a lot, and I thought her perspective would be super helpful. Lakshmi, can you tell us who you are?
Okay, so my name is Lakshmi Tannan. I'm her daughter. I am in seventh grade currently, and I know a lot of people have been like, how does your skin look so clear? When they're like, I get so many pimples and I use all the skincare. And I'm like, well, where do you get your skincare from? And they're like, I get it from Ulta, Sephora. And I don't think they understand like what really they need to find in skincare. Could you tell us a little bit?
Sure. So that's a really good point. There's a difference in when you get skincare from cosmetics place like Sephora, Ulta, or even like the drugstore versus medical grade skincare. Do you know that there's a difference between something that's called medical grade or sold in a doctor's office versus something that you can find at Sephora and Ulta? Who do you think has higher standards?
Probably the doctor's office.
Correct. And so for something to be able to be sold in a doctor's office and be called medical grade skincare, it has to be pure. And it has to, more importantly, say whatever it says on the bottle has to be true. So if it says 1% retinol, then guess what? It's got to be made of 1% retinol that's 99% pure. It's got to be accurate labeling. Now, the FDA governs cosmetics that are sold in Sephora, Ulta, Target, CVS, what have you, and they're not held to the same standard. So, for example, if you want to be on the A honor roll, can you be on the A honor roll with the C?
No.
No, exactly. So if you want to be medical grade skincare, you can't be medical grade skincare with impure or inaccurate labeling. So you can't say one thing and put something else in the bottle, but you can at places that sell that aren't governed by doctors' offices or don't hold themselves to that same standard. So does that explain a little bit about the difference between the purity and quality of products you can get in the doctor's office versus at Sephora or Ulta?
That makes a lot more sense now.
So in terms of, so a lot of your friends, are you wearing any makeup right now, actually, Lakshmi?
So no, I'm not, except for a little bit of mascara on my eyelashes, but I'm not wearing like any like foundation or concealer, blush or any of that. I think it's like, I don't wear it because skincare is like basically my makeup.
Well, it's good. You have a natural youthful glow, which is something we're always striving for women in our 40s, 50s and above. And so I think starting off with good, healthy skin helps you prevent from having, acne scars. And why don't you show us what you use?
Okay, so I have a whole routine. So I'm just going to walk you through it. So the first part you can use in the exfoliating cleanser. And I just rub this all over my face. You really want to get every part of your face, forehead, like top of your hairline. And then you can also, if you have like little bumps on your arm, you can rub them over here too.
I'm going to interrupt real quick. So Lakshmi has combination skin that's oily and then periodically dry on her cheeks because she swims year round. And so she's careful about the retinol when she's going in the pool water with lots of chlorine. Continue.
Right. So after using the exfoliating cleanser, I go on to dual action scrub. So this same thing with the exfoliating cleanser, you rub it all around your face and on your arms as well. Both of these you can use in the shower. I would recommend that's what I do. But if you're not taking a shower in the morning, you can obviously just rub it on your face, wash it off with like sink water.
Mm-hmm. And this dual action scrub has salicylic acid, so it's even more potent than the exfoliating beads in the exfoliating cleanser. Okay, so what do you do when you step out of the shower in the morning?
So after I get out of the shower, I take these complexion renewal pads and I just wipe down my face after like the entire shower, just wipe everything off just in case there's still like debris there.
Okay.
Next up, I take my illuminating AOX serum. It's kind of like a daily power defense.
It is.
And you just start off the skincare. I just put this on.
Mm-hmm. And it has topical DNA repair enzymes. Think of this as like a very light moisturizer. And that's something that's really important. If you're buying things at the drugstore that it's say non-comedogenic, that means it doesn't clog your pores. Because sometimes these things that you think you're doing to help your skin are actually harming your skin by clogging up your pores. Okay, right. Go ahead.
Next, I have a retinol. I feel like this helps me with my pimples because every time that I use this, it like in a few days, you can notice a difference within the amount of pimples that you have. And I feel like whenever I don't use it, I can notice a difference. But it also comes with kind of like a little bit of a cost because when I put it on, my skin starts like peeling
Yes, and is that an expected reaction?
It is because of how your body has to react to this, because this is trying to help new skin from your old skin that was a little bit more like drier.
Can I interrupt a little bit?
Yes, please.
So the way retinols, retinoic acid, things like different retin-A, Tazorac, the way they work is by making your cells divide more rapidly, so you have more youthful skin cells coming up to the surface. Now, that's great, but it also means you're going to peel with use. It's not going to peel forever, but as you have newer youthful cells coming in the very beginning of retinol use, you will notice some peeling, and you have to push through it. Your body will develop a tolerance to it, and then it will no longer peel because you will have reset the rate at which those skin cells are dividing. Now, I know you were about to say this. What's really, really important when you're using an effective, potent retinol or retinoic acid? What should that always be paired with?
Sunscreen.
Absolutely. And that's because when you have rapidly dividing skin cells, they're susceptible to damage from damage that can cause skin cancer and wrinkles from the UVA and UVB rays of the sun. So why don't you tell them about your sunscreen?
Okay, so my sunscreen I get from Elta MD, and it's like,
you use the UV clear, so it also
UV
is helpful for people who are acne prone.
yeah, and I put it like all over my face, and I feel like every time that you do your skincare routine, whether you're using retinol or not, you should still use it. Even when you're just going out, and it might not even be like that sunny, but you should always use sunscreen with like everything,
Excellent.
everywhere you go.
Very good. And then you can tell them about your last tube.
Yeah, you can use hydration cream, and you feel like your face is like a little dry, I would use the hydration cream. It really helps make your face just feel a lot more moist.
So this product line is Zeo Skin Health. It's a medical grade skincare line that we carry at our office at Tannan Plastic Surgery. And I want to emphasize that when you're seeing someone for your skincare, I would recommend going to a physician's office where you will, and I think specialties that you can look at are plastic surgery, ENT facial plastic surgery, so that's ear, nose, and throat doctors who specialize in facial aesthetics, and dermatologists. These are all different doctors and doctors' offices with a team of providers who will help you find a skincare regimen that's tailored to you, rather than just going into the store and willy-nilly buying things that will rack up a pretty hefty price tag and could actually be harming your skin rather than helping it. Yeah. Lakshmi, thank you for your help.
Yeah. Wait, can I talk about one more?
Sure.
So, how would you pronounce this? Like
tretinoin.
Tretinoin.
That's retinoic acid. That's a prescription. Again, another reason to see a physician or one of the physician extenders like nurses, nurse injectors, PAs.
So I use this whenever I have like a spot where I feel like a pimple is coming. I just rub this little cream like on that little spot. And you can do this like before you sleep in the morning, but it will definitely help like your pimple not be as, how would you say this?
It will help you with your acne. The other thing is usually we don't recommend doing both, retinoic acid prescription and retinol. So we try and recommend that you find one or the other for your regular daily use. And then retinoic acid prescription is definitely very helpful for spot treatment for acne. Follow us for more tips.
Bye.